University of Arkansas Medical Sciences are here to fill us in on the role of community health workers. We are visiting with Julie and Larissa today. This segment, of course, sponsored by UAMS. Welcome. Thanks for being here. Great to see you.
Yeah, thank you for having us.
So I know this is kind of a general question, but I need to know more about what a community health worker actually is. Who can take that response?
Yeah, I can.
Probably Larissa.
Yeah, I'll take it. Yeah, so community health worker, it's a pretty unique role, I think. It kind of falls under the umbrella of health. So we kind of help just navigate, any resources that are in the community. We kind of educate ourselves on that to be able to bring that back to the community. And a big part of it too is just having in language. So like myself speaking Spanish, and I have team members that speak Marshallese. So we're able to support our community members like that within that role. Yeah.
I love that because you're breaking down obstacles.
Exactly.
Having people get the help that they need. And speaking of that, obviously we know what a pharmacy is. People go to pharmacies all the time. But what other services do you provide there that we might not know?
Yeah, so aside from going to the pharmacy just to pick up your medicine, we actually, my pharmacy in particular, provides diabetes education. We also do tobacco cessation and help. We can actually prescribe the medications for that, and also counsel people through the process of quitting.
Yeah.
And then also Narcan counseling. That's a big issue, and just teaching people how to use it, when and why to use it. And just kind of sitting down and going through all those things.
Yeah, the education is so vital, I feel like, because a lot of times you're like, just take this medicine or whatever to help you and not understanding the full picture of what that means.
Right.
Yeah. Well, talking about community health workers, can you fill us in a little bit more on what they're doing in Northwest Arkansas, even throughout the state, outside of the walls of like the doctor's offices and pharmacies?
Yeah, absolutely. So with our team, we are a mobile health unit, and so we actually go out to specific locations within. Right now we're in Fayetteville, Springdale, and Rogers. So we are offering our health screenings. We still have COVID if people are interested, also the flu in the season. But yeah, just being able to bring that into the community where people are at, because obviously transportation can be a big issue for people. So that's kind of a stepping stone for us to try to get in there.
Yeah, for sure. How can someone get in touch and learn more about being a community health worker? Maybe they're interested in joining the program.
Definitely. So we have reoccurring events with these locations. So we actually have a website that you can go to see where our events are at, and it's communityhealth.uams.edu.
Okay.
And we go ahead and put our events on there, and so if anyone's interested, they can stop by.
Yeah, that's great. Anything else we need to know from the pharmacy perspective?
Well, I would just say that a lot of community health workers are now sort of being embedded in pharmacies, particularly community pharmacies, and so that's a place where people go oftentimes monthly to pick up their medications.
Sure,
and
yes.
so if they have someone on staff that they can sort of help with access to, or even just navigating the healthcare system, which can be very difficult.
Yeah.
Having that presence in a pharmacy it can be very valuable.
Yeah, I agree. I was speaking to my sister-in-law recently who speaks Spanish as a first language, and she was talking about when she moved to this country and how difficult it was for her to navigate, simply to navigate our system here. And I would imagine the services that you all provide would tackle that issue head on.
Yeah, definitely. And we do client work too. So if they're looking for that PCP that they don't have, we help and support with that as well.
Yeah.
And is anybody eligible?
We're really trying to hit the demographic of people that are underinsured or no insurance at all, or just don't have a PCP in general. So we really try to help put them into that system if they're really needing that, or just preventative health in general. So just supporting their basis of health.
That's awesome.
great.
You're
Yeah.
breaking down those barriers.
Yeah.
Well, thank you so much both for joining us. We appreciate you filling us
thanks
in
for
on
having
everything
us.
happening
Thank
with the
you.
community health workers.
Thanks.